So my name is Dr. Jacqui Pich and I am the Director of Studies, Student Matters and Curriculum here at UTS for nursing. I'm also a nursing researcher and I work in the area of violence in nursing. If I could hand over to the panel so I can see Lucy, if Lucy would like to introduce herself.
Yep. Hi everyone, my name is Lucy Rowe. I'm the manager of the clinical liaison team, which means that I oversee the clinical placements that you would go on when you undertake those experiences in our hospitals and our facilities. My background is in intensive care nursing as well.
Great, thanks Lucy.
No worries.
Joel, would you like to?
G'day, my name's Joel Zugai and I'm a lecturer in mental health nursing.
Thanks, Joel. And Natalie?
Hello everyone, my name is Natalie Govind and I am a lecturer in nursing. My background is intensive care and currently I look after first and third year clinical subjects.
Great, thanks Nat. And Jan?
Hello, I'm Jan Forber and I'm a Director of Studies for International Student Matters.
Great, thank you Jan. And that leaves us, we have a student who graduated last year who's working as a new graduate now, so let her introduce herself.
Hello, my name's Ellie. I graduated last year from UTS. I did the Bachelor of Nursing degree and I'm working at Hornsby Hospital now on my second rotation.
Great, thank you everyone, and we're all available. We'll all be taking turns to answer any of the questions that you have as well. Okay, so let me tell you about the school that you will be joining if you come to study with us at UTS. So the School of Nursing and Midwifery was formally established in 2020. So prior to that, we were the Faculty of Health. We weren't a discrete school. However, the disciplines of nursing and midwifery have been a prominent part of the UTS Faculty of Health for many decades. As a school, we're committed to improving the health and well-being of individuals and communities through world-class research, global connections, and inspirational evidence-based teaching. We're ranked #1 in Australia and #7 in the world. So you'll be joining a world-class university, and they're the QS World University Rankings by subject in 2020. And as well, our research is categorised as well above world standard. And that's based on a 2018 ranking. Our staff include lots of high-profile, award-winning educators and researchers, as well as experienced practicing clinicians. And we collaborate with our industry partners and work as part of an interdisciplinary team to develop world-class approaches to healthcare education and research. Our graduates are highly regarded and have a well-earned reputation as outstanding clinicians, as leaders, change agents, and innovative researchers. We have more than 3,000 students enrolled in our undergraduate and our postgraduate nursing and midwifery courses at UTS. Today's session is your opportunity to ask us your questions about studying here at UTS. So please type your questions into the Q&A box in your Zoom control panel and we will respond as your questions come through. If we have a lot of questions, you might receive your answer in a text reply from one of the panelists or from the Faculty of Health Marketing team who are here to help us moderate the Q&A. Being an online event, please bear with us if there are any technical issues, fingers crossed there aren't, and we will work to resolve them quickly. If you find you are not able to access the webinar at any point, please log out and then log back in again, and that usually resolves most issues. So if you haven't already, please watch our full info session video for the Bachelor of Nursing available on the Open Week website. It goes through the course in detail and it may answer a lot of your questions. Then consider dropping back into this QA session in 15 minutes time. Here's a quick overview though of the key stats for the Bachelor of Nursing. So you can see the Bachelor of Nursing the selection ranking for 2020 was between 78.95 full-time and 82.2 for part-time. It's a 3-year degree full-time. We also have two double degrees. So we have a degree that's partnered with Bachelor of Arts in Health in International Studies, and that is a 5-year full-time degree. Can't do that one part-time. And we also are partnered with Bachelor of Creative Intelligence in Innovation, and that one is a 4-year full-time degree. Again, you can't do that one part-time. The Bachelor of Nursing Accelerated, this is for people who may be already practicing as enrolled nurses and qualify according to the criterion. That takes, you get a year's credit for that, and that program will take you 2 years to do full-time. Okay, so students who successfully complete the program will be eligible to register as registered nurses with AHPRA. So AHPRA is our regulatory body. And registered nurses are health professionals who care for individuals and communities experiencing ill health and other life events. Our nurses or nurses practice person-centred care, evidence-based care to support our patients, and they also deliver preventative health initiatives in the community. And there are nearly 300,000 registered nurses in Australia working across a multitude of settings in the public, private and private sector, and also in community settings. Okay, so while we're waiting for some questions, might just have some questions here. So if you have any questions at any time, please just type those into the Q&A box. But I'm just going to run through some slides here around some commonly asked questions, I guess, that we have. So the first one there, I didn't study science in high school. Can I get into nursing? And the answer is absolutely. So while we do have science in our program, you don't need to have studied that in high school. It's not a prerequisite for coming in. So the assumed knowledge is just 2 units of English. Any 2 science of science and maths are recommended, but they're not a prerequisite, and you'll be able to cope with the science components and the maths components that are in the program. Okay, so the next question is saying, can I specialise as a nurse? And I might get someone else to answer that question. Natalie, would you mind answering that question around specialties in nursing?
Oh, sure. So yes, there is a vast range of opportunities for you to specialise as a nurse, and that can range from working in the traditional hospital setting, as well as more community private primary healthcare based nursing, as well as you can also work in policy development, WHO, global health opportunities. There is a huge variety of specialties that you can involve yourself in as a registered nurse. At UTS, we have a unique program in that there is an opportunity in 3rd year to choose an elective. And what that means is you get an opportunity to choose a specialty that you would like to learn more about. And that's quite unique for us here at UTS. So it's an opportunity if you have an interest in paediatrics, if you have an interest in operating theatre, if you have an interest in working in the community or palliative care, you can enrol in one of these subjects and then really get a sense and introduction to that specialty, which may give you an idea of where your pathway may lead once you graduate. But definitely you can specialise as a nurse, and there's definitely further postgraduate opportunities here as well.
Great, thanks Nat. I can see there's some questions that we've got to answer, so I might just give this one to Lucy. That's okay. So Lucy, the question is, how does placement work? Do students get to choose the ward and the hospital?
Yeah, so the clinical placements, I think, is the most exciting part of your degree. It's where you really get to use all the theoretical knowledge that you've learned and transfer that into practice. So when we come to allocating students to clinical placements, we have a lot of different factors that we take into consideration. And you do get to put in a preference list at the beginning of each session, which can indicate the hospital that you would really like to work in. And in some cases, we do even ask you to identify if there's a specialty area that you would like to do your clinical placement in. When we allocate you to clinical placements, we try to make sure that you have a really broad range of placements. So we look at sending you to different hospitals and different spaces to make sure that you kind of experience a different perspective of nursing in different environments. So I think that's really important as well. We also factor in where you live. So we don't want to send you to a placement that's far too far away. So we definitely look at your location, and we factor that in when we're allocating you to placements. So there's lots of different things that we do. When it comes to the specialty subjects that Nat was just talking about, we obviously will allocate you to a placement that's especially in that area. So if you choose a palliative care subject, you'll be allocated to a palliative care ward in one of the hospitals. And those placements could be in public facilities. So some of the big local health districts around Sydney, they can be in private facilities, community-based facilities, and we have even non-government organisations and smaller type facilities. So lots of variety for you guys to enjoy while you're on placement.
Great, thanks, Lucy. And I've just mentioned too, there are two subjects, so mental health nursing, fundamentals of mental health nursing, and also nursing care of the older person. And so those subjects would have specialist placements in those areas, but you would get a range of placements across your degree. So one of the other questions, is it possible to transfer from health science into nursing? My understanding is that you would need to go through UAC to do that. However, you may get some credit for subjects, but that is something around the recognition of prior learning, and I think we can provide the link to that, and the team will provide the link to that on our website. So one of these questions, the next question I can see there is, would I be able to choose where I work after I graduate? For example, the emergency section. So I might just ask get Ellie to answer this, as she's just gone through that whole process, and then we might add some detail after that.
Okay, so basically when you do get a new grad, so for myself being at Hornsby, they do ask you, well, in some cases they'll ask you if there's any way that you would like to work, and they do take that into account, but unfortunately it's not, you know, it's not certain. So you just get allocated wherever. So my first rotation was, I was lucky enough to get emergency, and I absolutely loved it. So that was awesome. And now I'm on an orthopedics ward. So yeah, hopefully that answers your question.
Yeah, so typically what will happen if you get a new grad position with New South Wales Health, you'll be put into a clinical rotation where you will do 2 or 3 different placements in different areas. And as Ellie said, sometimes you do have choice around that, but sometimes that choice is limited. And then after your second year, that's when you can kind of apply to go into the area that you might want to end up working in. Okay, so after 3 years of the Bachelor nursing degree, are you allowed to transfer to a different country, for example, America, as a registered nurse? So the answer, it's not as easy as yes. So yes, you can. However, it's important to note that you have to then satisfy the regulatory bodies in each country. So in any country that you're wanting to go to, you have to be able to satisfy their registration requirements. So just because you're a registered nurse in Australia, it's not an automatic thing. So for example, the American example there, they do an exam prior to registering. And so my understanding is you would have to provide evidence of your studies here, but you would also have to sit that exam and pass that exam over there. So definitely with nursing, the opportunity to travel, you know, around the world is one of the great allures of the profession. However, it's not just as easy as transferring. So you need to kind of research which country you're wanting to go to. Did anyone else in the team have anything they wanted to add around that?
I can add something. I think
Thanks.
once you have some experience, so if you did your degree here in Australia and got several years experience here, then my understanding is then that can give you more flexibility to be able to move around to different countries, because it's not purely your qualification, you've also got some experience as a registered nurse to be taking with you. So I know some of the European countries in the UK, they would probably look on that experience more favourably, not over and above just having the degree, if you understand what I mean.
Okay, so I might get Natalie, if you would like to answer this question, if that's okay. So are there any overseas opportunities?
Okay, so in relation to clinical experiences overseas, we do have a specialty subject, so one of those elective subjects that you could undertake in third year called Global Health. And as part of Global Health, you have an opportunity to attend what we call an offshore clinical placement. So that's a clinical experience in a country, obviously not Australia, in a country that we have a relationship with. And most likely it is a country that may be, their health system is different to what we have here in Australia. So for example, we currently have relationships with Indonesia and Fiji. And so at this stage, one of those opportunities could be to attend clinical experience at either of those countries.
Great, thanks, Nat.
It's okay.
Okay, I'm going to throw this out to the team. So the question is, what is the most challenging part of the first year of the nursing program?
Do you want me to?
So maybe I'll get Ellie as a student, recent former student, and then I might call on Nat, sorry to call on Nat again, but because she was the coordinator of the first year clinical subject, so she will have some experiences to share as well.
So obviously it's subjective, so some people will find some things harder than others. I think for myself, placement was the most challenging thing, because you learn all this theory, and even though you're really excited, you're going into an environment where you feel like you don't know anything and you feel sort of like a burden to the nurses, which you're not, definitely not, but that's, you know, a whole new thing, especially if for myself, I'd never worked full time, so placement can be quite tiring. So just taking into account that when you are on placement, to look after your mental health and making sure you're getting lots of rest on the weekend. And then that's, I think, just getting used to university, how a university runs with all its assignments and everything as well, but you'll get into the hang of it really quickly. So, but yeah, I would say that placements is the most challenging thing, because it's so different to what you've ever done, but it's the most fun part as well.
Great, did you have anything to add, Nat, just from your experiences with your first year students?
I think everyone will have a different experience, and so this is by no means, I cannot give you a sort of a definitive answer. It really depends on the experience that you bring from your current situation. So if you're just leaving high school, the experiences you bring from how you learnt in high school into university. It also could be that this could be your second career opportunity, and you're transitioning from another career, or you've studied already and you're moving into a new career path. So individually, you will bring your own experiences to this way of studying. And I think that's the main shift that I noticed. You're moving from, if you're coming from high school, you may feel that your transition may be a lot harder to manage, in the sense that we drive, when you're in university, we drive from a place called independent learning and self-directed learning. And that all comes from adult learning principles. And I know those all sound like, what you're talking about, why does this matter? But what it means is we try and provide you with skills that you are then take ownership of the way you learn. So the transition can be a bit tricky, because there's a lot of responsibility then falls on you as the learner to keep your own timetable, to make sure you arrive to class, to do preparation work before you come to class. But we work with you during those first few weeks of university to make sure that you settle in, that you have all the resources that you need, that you know the university services that are available to you, to ensure that you have a successful time here with us at UTS. So it is a different experience, but I think if you come with open eyes and if you come with a sense of wanting to learn and be part of university life, then you're going to definitely succeed and make the most of your experience. So I suppose that's the best way I can answer the question. I'm not sure if I have given you any clear information, but by all means, ask another question.
I can see a question there that Joel would like to answer. So the question is it possible to specialise in more than one area?
Yeah, so the reason why I elected to answer that question is because of the number of different things that I've done with nursing, and I'm sure many of my colleagues have as well. But one of the great things about nursing is that your destiny is certainly not narrow. You know, there are so many different specialties out there and a lot of opportunities. So you really can kind of look at specialties in nursing as a kind of an a la carte arrangement. You can really choose whatever you want to do, and there's great scope for movement between specialties. So I would say I'm relatively early on in my career, mid-career maybe, and I've worked in med-surg, I've worked in acute care, I worked for the military for a number of years, I've worked in mental health care in the acute setting, and now I'm working in academia. So there's tremendous scope for movement across the different specialties, and I'm sure my colleagues will agree and have similar stories themselves.
I really echo what Joel says there. I think for one degree, you can have multiple different careers, whereas in other aspects, you might need to go and restudy or do a whole nother degree. Nursing is one of these amazing courses that you do 1 3-year course, and then you have so many options at your fingertips, and you don't always have to go back and restudy to be able to completely change tact and go down a completely different career path. If you're still within that nursing realm, but there's so many different things you can choose, and I think it's one of the best careers that you could choose.
That's right, and we're not biased at all.
No.
There's a question there that you were going to answer, Lucy. Would you like to read that one out and answer that question?
So it's, would the placement you're given help you find a job in that particular specialty area? So whilst the placement itself doesn't necessarily guarantee you a job in an area, what it does do is it gives you experience in that area and gives you a language and knowledge and exposure to that space. So that in an interview, you might be able to use some of that experience to give examples, which is really beneficial, I think, when you're doing interviews to get your first job and even any jobs thereafter. And also it gives you an idea if this is the area for you or not. And I know a lot of people choose specialty areas and realise that it might not be for them. And that's just as valuable an experience as understanding that it is the specialty area of choice. With particular reference to paediatrics, which this person's written in this question, at UTS, we do acknowledge that paediatrics is a really specialised area of nursing, and we can funnel students through more paediatric placements than, say, other students if they show a particular interest in this area. And given that there are only very few paediatric hospitals in Sydney, we tend to find that those students that do a lot of placements in paediatrics will go on to have jobs there, because then the staff on the ward and the people who are doing the interviews will get to know you and will take you on board. So that's a really exciting opportunity.
Great, thanks, Lucy.
Nice.
Okay. So I wonder, Jan, if you would like to answer this question. Sorry to put you on the spot, but the question is, could you give some examples of the kinds of assessments that students can expect in the nursing degree? Are there any essays?
All right. So assessments, always a
yes.
question. So we use a very wide range of different types of assessments across the 3 years of the Bachelor of Nursing program. And there's several reasons for that. I mean, some particularly question about essays, there may be some essay style assessment tasks, But equally, there will be group work tasks where you might be required to do a presentation or design a poster, for example. There will be tasks around case studies. So you'll be given a clinical scenario and be asked to answer questions around that. So yeah, the short answer is there's a range of things. So even if you're really adverse and you don't like writing essays, there'll be lots of other things that will require different types of skill sets for you to be able to address those assessment items. So they're broad. And something that's a particular perhaps feature of UTS is we try to ensure that our assessment tasks are what we call authentic. So they're about nursing and doing nursing and how you think like a nurse, rather than, you know, lots and lots and lots of essays which aren't actually necessarily getting you to work and think like a nurse. So I think you will find the assessment tasks are very relevant to what it is you're aiming for and what you're going to be doing as a registered nurse.
Thanks, Jan. And yeah, I would just echo that and say we have theoretical assessments, you know, that may be those written assessments or quizzes, those types of presentations. And we also have assessments that are, I guess, more around your nursing practice. So we would call those OSCEs, where you might be in a simulated environment at the university and you would need to kind of participate and show your skills in that environment. We also have clinical vivas. What that is you're talking rather than writing stuff down. You're explaining what you're thinking to us, so that we can see again that critical thinking and your clinical reasoning. And then when you're on placement as well, we want to make sure that you're able to you know, translate what you have learnt in the labs to that clinical environment. And so you'll have facilitators there who will be there to kind of mentor and to look after you there. And also we'll be looking at assessing some clinical skills there and your clinical practice as well. Because what we want is, you know, in that last placement that you have, we're really mindful of, okay, the next time this student is out, they're going to be a registered nurse. So we want to make sure that you're armed with all the necessary skills and thinking to be able to make that transition. So I hope that answers your question. There's lots of different types. Okay. So I'll answer this one. So the next question, and feel free if anyone wants to answer, is on average, do students come into uni 5 days of the week or less for a nursing degree? And that's always important because we need to balance life, work and fun, all of those different things. So no, it would be unlikely that you would come in for 5 days of the week. And you will have an opportunity to timetable yourself so that you can timetable, I guess, the classes that you need to attend to minimise the amount of days that you come in, or you might want to say, no, I want to spread it out. So there is flexibility in the timetable for you to be able to manage that. But it's not like it is a full-time load, but in saying that it's not full-time on campus, if that makes sense.
If you like, I'll quickly just answer that question. Is exchange possible with a nursing degree? I'm assuming that you mean as part of your nursing degree, can you go on an exchange? From my understanding, that's only available in the combined degree of Bachelor of Nursing and Bachelor of Arts International Studies, where as part of that program of international study, you have the opportunity to complete an exchange at a location, one of the global locations, for a period of 10 to 12 months. So a significant proportion of one of your years of that combined degree will be attending university or college at another location based on your international studies. So as part of the nursing degree specifically, we don't have opportunity for you to do an exchange program as part of the accredited program that we offer. Is that correct, Jacqui?
Correct. Thank you, Nat.
That's okay.
Okay, Lucy, I can see there's a couple of questions you've got your hand up for, so if you would like to answer those.
Yeah, so the first question is about night shifts on clinical placement and how long are placement shifts. So most of your placements, I'd say 99% will be AM and what we call PM shifts. So that starts from 7 a.m. in the morning till 3:30 in the afternoon for an AM shift, and a PM shift would be 1:30 in the afternoon till around 10 p.m. There's only been 1 or 2 placements where night shifts are performed, and that's been in a pilot study or a trial. So that's not a normal part of our clinical placement experience. If you were to select your interest in those particular trials, then you would be required to do night shift in your final year of study, but that's very rare for our students. The next one was about burn and trauma rehab, and that's quite a specialised, really specialised area. There's 2 burns units in Sydney at the Royal North Shore Hospital and Concord Hospital, and they would obviously offer rehab. We don't do that as a specialty subject, but you could definitely be placed in those areas. But it might just be part of any of your subjects. It might not be part of a specialty subject. So there's always a chance that you could be placed there. And I would recommend that if you're really interested in a particular area, that you let the clinical practice unit know, and they're the people that allocate the placements. And they can always put a note on your file and try and help you get those placements in those particular areas.
Great, thanks Lucy. Now I did see a question up here I was going to answer. So there was a question there. So this is again around, I guess, how much time you need to devote to your studies. And the question from is, I work full-time 4 days a week. Would I be able to study 1 day a week to be full-time? And realistically, I would say that's unlikely because not just in terms of the timetable logistics, but also for every hour that you're studying, you also have to remember that you're putting in work, you know, preparing for your studies, preparing for class, preparing for labs. You're also doing assessments. So if you wanted to stay working 4 days a week, my suggestion would be to come into the program as part-time. I think you'd be putting a lot of pressure on yourself to try to manage everything and to, obviously when you come in to study as well, you want to make sure that you're studying to the best of your ability so that you can end up being the best nurse that you can be. And I think if you try to squeeze that too much in, it probably wouldn't work for you. Okay, question is, are there any extracurricular or leadership opportunities in the Bachelor of Nursing? So yes, there are. So I'm going to talk about, we have first, second and third year student representatives, and Joel is actually our second year coordinator. So what that means is you put in an expression of interest and you interview and you become like the leadership group, I guess, for that year. And in that role, what we get you to do is you liaise with your student colleagues, and then you bring that information back and you would have meetings with your coordinator, which if you were in second year would be Joel. And then you're kind of the voice of the students, I guess, and then Joel can relay that information on to the second year coordinators as well. We also have what's called NAMSOC, and NAMSOC stands for Nursing and Midwifery Society. And that is a leadership body again within the university structure, and they have funding attached to them as well. And they're the guys who organise the ball at the end of the year, for example. So yes, there are different opportunities for you to become involved in those bodies. Does anyone else have anything else they would like to add around that?
I think there are roles within the university, the wider university, that seek out student representation and student engagement. There's also sort of body programs where students can be peer supports for other students. So I think there are across the university a range of things where people could get involved in activities that might not necessarily be labelled leadership, but they would be extracurricular and would give you a broader experience while you're at university, but also give you some additional skills in terms of employability for when you've completed your programme of study.
Great, thanks, Jan.
I might just quickly answer that. Can you do global studies in America for your third year question? Currently, we do not have, there is no agreement in place where we send students to America to complete clinical placement as part of global health. So in the current program, no, we don't have that opportunity. Not saying that in the future that might be a possibility, but in the way we are structured at the moment, we're not in a position to send students to America to do clinical placement experiences.
Okay, so the question is, and all the panel can jump in on this because we will all have our views on what makes UTS the best, but what makes UTS stand out compared to other universities in Australia that offer nursing? So I think one of the things that always comes to my mind is the third year specialty subjects, where you can, as Lucy has said, you have that opportunity if you're interested in critical care nursing, paediatric nursing, for example, mental health. You have that opportunity not just to do that in your normal program, but you have a specialty course devoted to that. So you get to find out more information around that, and sometimes it may be, oh, actually, I think this is amazing, this is what I'm going to do, or it may be that it's something that you decide that you don't want to, but it gives you that taster before you actually go out into the nursing workforce. And to me, I think definitely that is one of the strong points of study at UTS. Who else would like to? Lucy, would you like to comment on the facilities that we have in the clinical?
Yeah, we only utilise really top quality facilities for our clinical placements. We make sure that you're able to achieve all of those learning objectives that you need, where you can practice the skills that you have to achieve. And feedback from a lot of the facilities is that UTS students are their preferred student. And that then translates into a lot of UTS students getting jobs at the end of the degree, which we're really proud of, because it is quite competitive towards the end in terms of getting a position. So I think by coming to UTS, you put yourself in a really great position to be getting a new graduate position at the end.
That's right, and you have the opportunity in terms of those clinical placements to go to specialist paediatric hospitals, for example, as well as, you know, the big hospitals around Sydney that you'd all be familiar with, so Royal North Shore, Prince of Wales, St Vincent's. The other thing that I was going to say is we have a really amazing facilities, like our labs and our simulation facilities are world class and quite amazing. And you have all of those facilities. We also have practice labs, so that if you wanted to go in and practice some skills that you'd learnt in lab, you can book in and you can spend time in the practice lab. And we also always have a dedicated staff member in there who's a registered nurse who is there to, you know, provide some assistance to you. So these are, you know, great opportunities. We've got an amazing new library that was just built as well. So lots of amazing facilities that UTS has as well. Okay, I might get Joel. I'm going to put Joel on the spot because it's been a bit quiet. Joel, how many people are in each class?
It does depend on the nature of the class, whether or not it's a clinical lab or a theoretical class. But for theoretical classes, there's a maximum of 31 students. And I think for labs, it's 27. So, yeah.
Yeah, and I will just add, so for the labs, 28, that was close. So usually 28. However, at present, what we've been doing is running labs with 14 students in them because of social distancing. And we have found that smaller size is something that we may look to be able to continue, perhaps not all the time, but it's certainly something that we are looking to offer as well. Typically lectures where we would have a lot of people. However, these are also offered online, and we're probably, you know, in this environment doing that online as well. Okay, So during clinical placement, so I'll throw this to you, Lucy, do students have any resources to utilise during clinical placement?
Yeah, there's a lot of resources that you can utilise. I suppose the main resource is actually a person, your clinical facilitator, who is a registered nurse with usually more than 5 years clinical experience. And they take you on through the whole journey of your placement, and they support you, they mentor you, guide you, and ultimately they assess you on your clinical placement. And I think that they are a great resource for you to ask a lot of questions and bounce ideas off, and they can direct you to a lot of the areas where you can get more information. Also, you have all of your academic and theory, access to all of those notes and PowerPoints and resources, and you can always talk with your subject coordinator if you need more resources. But in every facility that you visit, there will be their own sort of online portal where you'll be able to access a vast array of online digital material that might relate to processes or policies or the ways that you administer certain medications. And they're sort of like step-by-step guides to help you through sort of any procedures that you might be unfamiliar with. So we don't expect you to go on clinical placement with no support. We know that it can be a really challenging time, but it's also really exciting. So I think it's great to have that specialised clinical facilitator who can guide you and sort of support you through that whole journey.
Great, thanks, Lucy. And Jan, I can see there's a couple of questions that you wanted to answer. So if you could do those now, that'd be great.
Yep, okay. So the first one is the question, can you do a dual degree in nursing and midwifery? And if not, how do you go about doing midwifery after nursing? And there's a question further on as well about can you work as both a nurse and a midwife? So I'll try and answer them both together. So at UTS, we have direct entry to a Bachelor of Midwifery, and we have direct entry to a Bachelor of Nursing. So they're quite separate programs of study. So you can come in straight away and do study to become a midwife. Many people though will do nursing, and then after they have completed their nursing, you can then do a graduate certificate in midwifery, and then you would be dual qualified as both a nurse and a midwife. And in that scenario, you could work as a nurse or a midwife because you have dual qualifications. If you only have a nursing degree, you can work as a nurse. If you only have a midwifery degree, you can work as a midwife. So I hope that explains and answers those couple of questions. But certainly you can do your nursing and then you can go on to do midwifery as a postgraduate qualification. Pretty competitive, but yes, that can be done. And the other question that I picked up was, are most of the first year nursing students recent school leavers? And will it be harder for me to get in as a non-recent school leaver? I think the cohort of students at UTS represents a really good mix of school leavers, more mature students, even people making a really, much later career change and coming into nursing. And we also have an international student body as well. So I think you will find within classes you have some of all of those groups, and that actually makes for a very interesting learning experience because everyone's bringing different qualities and life experiences to the classroom. So you won't find yourself the only non-recent school leaver in a class or in a group. There'll be lots of people from different entry points, and it should not make it any harder for you to get into the program if you meet the requirements for entry.
Sorry guys, I'm just searching. There's lots of questions there at the moment.
Mm.
Do you want me just to answer that one about, is there any areas of nursing that have a higher employability rate?
No.
I suppose it's, when we've mentioned electives and specialty areas, but when you graduate from the Bachelor of Nursing program, you graduate with a Bachelor of Nursing, meaning that you can work as a registered nurse wherever you meet the qualifications and the experience. So usually what happens is graduates transition into a graduate program or into a position for a registered nurse first year out, so first year since graduation. So there really isn't any areas of nursing, I don't think, and please feel free, everyone else on the panel, to correct me, but it really can depend on the current climate. But if most areas of nursing, there is always employment. And you normally find your specialty once you've been working for a few years and you move into that area that you've got an interest in. And as Joel mentioned from in the beginning, you can change your specialty as you progress through your career. So in relation to, and if one's more, more employable than the other, there's probably the answer is no. It's really up to what you're after and the career path that you want to go down. And once you have experience and you move forward, then the opportunities are really limitless from my experience. And I'm sure the panelists may have their experiences to share as well. So it's really up to you, I think, where you go with your degree.
Yeah, no, thanks, Nat. There's a few questions around COVID, which I guess is understandable. And certainly this year it posed a challenge to everyone. But certainly for us teaching here and for our students, it was a bit of a challenge, and we did have to do a bit of a pivot in terms of how we presented the program. So there were a couple of things around there. So I guess in terms of placements, so Lucy, do you want to comment on placements at the moment?
So clinical placements are going ahead in all of our facilities that we partner with. There are obviously some changes to the way we are now practicing healthcare across Australia and the world. So whilst clinical placements are going ahead, they do look a little bit different. Students are provided with all of the equipment that you need to successfully care for patients. And at this point in time, you will not be asked to care for anyone who has COVID, so who is a COVID positive patient. So I think that's a great thing at the moment. So you will be provided with, we call it PPE, which is personal protective equipment. So I'm sure you've seen pictures of the masks and all the gloves and gowns and things. We have ample supply in Australia of PPE now. So all of the students are able to utilise that appropriately. And there's lots of training that you do around that, so you can feel confident in using that PPE. But I think it's really great that clinical placements are continuing, because there's so much to learn in this time with healthcare. And you'll be placed in multiple different areas. Some you'll never see there might not be a COVID patient or a COVID suspected patient there. In other areas, they might be more common. So we definitely provide you with a lot of skills before you go, and then a lot of training on your placement in order to manage that properly.
And in terms of the other question there was, will everything be online? So I guess this session, there's a mix. So we have some things that are online and some things that are on campus. And that's our plan. We're obviously impacted on what, New South Wales government tells us to do. But the plan at this stage, so what we've had to do is to have social distancing in our labs. And that's where I said we're still running our labs. They're just with half the number of students. So we've got the answer to that is we have a mix where we can put something online. We may well put something online, but we do have a mix of, so a blended approach for that. So there was a question, sorry, scrolling around, was around placement. So I'll answer this question is, how many weeks of theory are there in the degree before we begin placements? So next year we're transitioning to a new Bachelor of Nursing degree. And your first placement will be 3 weeks, and that will occur in spring sessions. So at UTS we have autumn and spring sessions, which are like first semester, second semester. So when you come and start with us in autumn, you will do an introduction to clinical placement, clinical subject, and actually Natalie will be the coordinator of that subject. And so this is to familiarise yourself with that clinical environment and to have the time to kind of become more confident with the skills that you will need to then go out on your first placement. So the first placement would happen in spring session, and that will be a 3-week placement. There was also a question that I noticed there around the amount of time in placements, and does that increase? And yes, it does. So it starts from 3 weeks in first year, so 120 hours, and that goes to 400 hours in third year. So in your final placement, you're going to have a longer 6-week placement where you're out, and that is to make sure that you really have the time to practice working as a nurse, essentially. So really in that final placement, what we're expecting is that you'll actually be managing a patient load and really working as part of the team. Obviously, you'll still be mentored and supervised by a registered nurse, but it gives you the time to really be able to settle into the ward routine and to become comfortable in that area. And I'll just get, Ellie was going to comment on that.
I think 6 weeks or 4-week placements do sound like, you know, a big placement that you have to work towards. But from my experience, I always found those placements the most rewarding, because you genuinely do start to feel like a nurse. And I remember my 3rd year placement at the start of the year, and it was 4 weeks in a respiratory ward. And I remember saying, you know, oh, now I feel like a nurse, like on the 3rd and 4th week, and you do start to take a patient load. So just have that in the back of your mind if you're feeling anxious about the longer placements. It's definitely 100% worth it.
Great. Okay, so we've got a few questions there and a little bit more time, so we'll try to bring those through. Let's try to get through them. So Natalie was going to answer this question. So what type of balance would you recommend for a student that graduated high school this year for a full-time degree with a part-time job, ?
So I suppose I was going to say, I'm not sure how many hours you're working part-time, but if you're coming from high school, I think the main difference is that you would most likely be used to a study load. So you go to, you know, you're attending school 5 days a week. You have subjects that you're completing, and attached to those subjects are, you know, you do extra work at home as well as in class. So it's a similar approach, but in a way you're not actually in the classroom for that same number of hours, but the work around the subjects that you will be undertaking will probably feel the same as what you did in high school. So depending on how much sort of extra work you did at home will be what you're used to as you move into university. So even though we might only see you for a couple of hours a week in a tutorial class, the work associated with that learning in the class, as well as your self-directed work, would probably feel similar to what you've been doing for one of your subjects as you've been studying for the HSC, for example. So it's a similar workload, but it's just in a different way, where a lot of it may be done individually, or you could do it as a study group with other nursing students, but it's more, the ownership becomes on you rather than you coming to school 5 days a week and sitting with your classroom teacher for those times during the week. So it is possible to work part-time and study. I did it when I did my degree. It just depends on the number of hours you mean when you mean part-time, because that can impact on your ability to be able to study and have a balance, and making sure that you've got restful periods throughout the week.
Okay, so I'm mindful of the time, so I'm going to wrap up with a couple of questions. So there's a question there about the balance, yes, between theory and prac. And so to answer that question, what I would say is that in each session, apart from first session and first year, you will do theoretical subjects and you will do clinical practical subjects. So that that ratio may be, say, in maybe 1 out of the 4 subjects. However, they have a practical attached to them. So they're going to have a 2 to 6 week clinical placement. So really it kind of balances out in terms of the theory and the practical. The other question, I might just get Lucy to answer. This is our last question, perhaps. The question there about neonatal nursing, Lucy.
Yeah, look, it is a very specialised area of nursing. Neonatal intensive care nursing is an amazing area. We do a paediatric specialty subject in 3rd year, and there's also a family and children's nursing theoretical subject in 2nd year. So there's lots of times throughout the degree where you do talk about children's health and children's wellness. So you can do placements in that area, and you can always specialise once you graduate from university. So you might do a rotation in your 1st year out, and you can always transfer into that specialty area as well.
Somehow I just got rid of the screen. I don't know how I did that. I'm sorry. That's technology, but with 1 minute to go. I think then we will wrap it up there. So there is a live chat that is still going, one-on-one live chat until 8 o'clock. Tonight, where we'll be available, staff will be available to answer any of those questions that we had missed. There is the video as well that we would encourage you to have a listen to. The website as well has lots of information. So look, we are here to answer your questions. We hope that today has been helpful for you. And most of all, we hope that we will see you all next year as brand new nursing students with us here at UTS. So I'd like to thank all of the panelists for giving up their time today to come along to meet you all and to answer those questions, and to marketing for organising this as well. So thanks everybody.